Yeah, we should probably talk about like what to do if you don't have like you have an unsupportive person.
Spouse
Yeah, like either
Yeah.
zero
or partner.
support or the people around you are not very kind and helpful.
Yeah.
But also, I mean, this is like the flip side of that. If you're doing it for someone or for,
Yeah. So let's
maybe
start
those
with
are
the
your intentions.
easier one, which is if you're doing it for someone else, guess what? It
Bad
probably
idea.
won't change things. I remember I had
Yeah.
a bariatric client that came in and was like just not taking it seriously, and we're talking about like why she's going to do it, and she's like, well, hopefully my mom will finally love me. And I like shut
Oh
my
man.
computer and I like looked at her and I'm like, here's the thing, hon. If your mom doesn't love you because you're fat, she's going to find something else not to love you for that you don't have any control over because that's power.
Hey guys, it's Mel, your host of the Cutting Edge podcast. This is a show where we talk transformation from every angle, body, mind, and confidence with a little sparkle and a whole lot of truth. I'm joined by my amazing co-host, Dr. Omar Beidas, and the plastic surgery pro, and Ashlyn Douglass-Barnes, our go-to therapist and mindset queen. Now, quick disclaimer, none of us are your doctor or therapist. We are just here sharing real talk, real stories, and real growth. So grab your protein shake, settle in, and let's get into it. This is The Cutting Edge.
Hey, it's Ashlyn. Just one more thing before we begin. I will be sharing some of my own plastic surgery journey, which is personal to me and may not reflect what others go through. And if you're a current client of mine, please talk with me first before listening because knowing personal details about me could affect your therapy. And your well-being always comes first. Now on to the show.
Welcome back to the Cutting Edge podcast, and I am your host, Mel.
I am Ashlyn Douglass-Barnes, licensed clinical social worker and bariatric patient and skin removal patient.
I'm Dr. Omar Beidas. I'm a board certified plastic surgeon specializing in breast and body and plastic surgery after weight loss.
Yes. Yeah, we got all of the letters and degrees in the house. And I'm really excited because we've teamed up, and what we're talking about is to make sure you guys are safe, you guys are knowledgeable about decisions that you're making about your body, especially when it comes to plastics. Those are permanent changes. So that's why we have a therapist on and we have your surgeon, because those go hand in hand, and we definitely need it as the patient going in. So today, what we decided to talk about is support, because it needs its own episode, guys. Like that's how much of a big deal it is. So let's get into it. So Dr. Beidas, what kind of support are you looking for when you get a patient?
That's a great question. So generally, the support we want to make sure patients have, and I think we've touched on this on a few other times, but I'm glad we're doing an episode specifically on this. I think one of the most important things is going to be the social support. So, we want to make sure, even if you don't have kids, even if you don't have pets, you can't recover through surgery alone. Um, at least, I mean, I don't think it's possible. I don't think I've had any patient do it. We always want to make sure there's someone, whether it's a spouse, whether it's a parent, whether it's a child, depending on how old the patient is. Sometimes we have, patients who have 20-year-olds who are, capable of helping. Sometimes it's a friend or a neighbor. We just want to make sure at least there's a person to help a patient get through the first few days. Sometimes it's a nurse's aide. We have patients who come from out of town and have no one who can come fly with them and be with them for 10 days or 2 weeks. So they hire a nurse's aide. So the social support is probably one of the big things that we ask, and we ask early on at the time of consultation to make sure that patients have given this some thought and are, will tell us, yes, I've got someone, or no, I don't have anyone. And that's generally going to be a little bit of a red flag. And we want to make sure we navigate that and help them find someone, or help them, with a nurse's aide again. Usually that might be someone who's coming from out of town. That's probably the biggest one. Other ones can include, mental health support. And as we talked about prior, sometimes you just need tools for after surgery, more like medical things and not so much emotional or people support.
Well, and
you can probably talk more about that.
Through
so funny because I was thinking of all the like medical support. Like you may need a physical therapist, you may need the compression person, you may need your cardiologist, like all your medical people. So it's funny. I was thinking also on like the medical side, you may also need some support there if your conditions aren't great or don't improve, like we talked about last time, where sometimes like we may need to get clearance, and so we may need to go back and get further information. It's just funny because I know this is going to be a lot about like social support and mental health support, but I also want to throw in there's also probably some medical support that people sometimes need. There may be, especially one I'm thinking about is more like physical therapy if we have any kind of mobility limitation, or even sometimes just
Yeah,
sleeping all wonky.
Hey friends, this episode is sponsored by findabariatrictherapist.com because bariatric life is full of ups and downs and everything in between, but you don't have to go through it alone. Findabariatrictherapist.com makes it easy to connect with therapists who truly understand your journey, the mindset shifts, the identity changes, and all the real life challenges that come after surgery. Because therapy designed for bariatric patients changes everything. Visit findabariatrictherapist.com and find your support today.
that's a great point. I mean, generally, some of the things you mentioned, like cardiology, pulmonology, I mean, thankfully for most weight loss patients, that really goes away um, to the point where we really don't need specialty clearances, but for, I'd say, if not 100%, very close to 100% of our weight loss patients, we do get a primary care doctor clearance. So we just want to make sure their labs are okay, their nutrition's okay, you know, vitamin levels are all that's good. We kind of touched on that last week as well. Um, you know, certainly if you do see a specialist, so if you do have a cardiologist for whatever reason, if you see a pulmonologist for whatever reason, if you use a CPAP, if you've had a history of a blood clot, we do want to then bring in those other physicians, and we want to make sure we're communicating with them, and they're aware that you as a patient are having surgery. But that is more on the front end. So once we get that letter of clearance, it doesn't, I don't want to say it doesn't matter after surgery, but basically we now have that other physicians or other specialists, whether it's one, two, or three physicians, recommendation regarding your medications. If it's a blood thinner, when to stop it, what to switch to, when to restart it. So really that plays more of an important part. And again, we kind of talk about all that at the consultation. So at that point, we'll give you all the clearances that we're going to ask for. And we leave it on the patient to make sure that those documents all get to us back in a timely fashion before their surgery.
Do you recommend now, say if you do have specialists and other things to get checked on to be cleared, would you think there should be a follow-up maybe with the other doctors, like seeing you after you've had, you know, your plastics done maybe a few months out? Would that be like, do you guys recommend that, or is it something that we could do if we wanted to, I guess?
I think it depends on the patient and the reason you're seeing a specialist. I mean, for the most part, once your condition's stable, your specialist is probably only seeing you once or twice a year,
Right.
depending on the acuity of the situation. Um, you know, I would say the ones we tend to want to make sure are going to see someone quickly after surgery are your like hematologist or your cardiologist if you're on a blood thinner, because sometimes depending on what medication you're on, the levels might need to be checked. When you like Coumadin, for example, has to be monitored, and I think a lot of people are getting off of that now anyway for that reason because it's needs constant monitoring and lab checks. Um, and so that would be one where generally you will need to follow up pretty soon after an operation. Most other things, you know, like a pulmonologist, they'll give us your CPAP settings, and we make sure we have the same machine or whatever, and know those settings if you're in the operating room and need to use CPAP in the recovery area, for example, or if you're spending that night in the hospital. And hematology is just something in general where sometimes we need to, like, say you have a bleeding tendency and you have a deficiency like hemophilia. You might need a medication in the pre-op area. Sometimes we admit patients the night before to give it to them like 12 hours before surgery, then 5 hours, 6 hours before surgery. Again, this is all based on what the hematologist tells us to do.
Right.
I'm not managing that. And so those are the ones that generally need closer following. But cardiology, pulmonology, rheumatology, for example, you may need to follow up with because some of those medications can affect how you heal. So you'll want to see them sooner than 1 year or 6 months after surgery. But for the most part, you don't need to follow them closely.
How about like someone who's seeing maybe who has lymphedema? Would that like tend to get worse after surgery, remain the same?
It does, yeah, for sure. So lymphedema is definitely something where, and even for patients who don't have lymphedema, you're getting a surgical incision, we're taking off skin, we're taking off fat. And even if we're not doing that, just getting lipo, for example, is going to cause swelling, right? And it's going to affect your lymph channels to some degree. So we always tell patients swelling can last. Generally, most of it, let's say 90% of it will be gone at 3 months, but that's not the same for everyone. Some patients might have, still 80% of their swelling at 3 months. And it's usually almost all of it will be gone at about a year. But again, the more activity you start doing, we clear you at 6 weeks to go back to swimming, biking, whatever, any activity you want. But when you start doing those things, your lymphatics again are kind of slow to learn how to drain everything again, because they may have to reroute since some of those things have been cut or injured. So now they're learning to reroute different channels. And so the swelling can be worse for the first few months after surgery, even up to a year. And that can be permanent.
Ooh. For those that have no idea what lymphedema is, can you explain it real quick?
Yeah, so lymphedema is, clinically you'll see a increased swelling or permanent swelling or delayed drainage of some fluid from the body. Generally, it's going to be a body part, but it can affect both lower extremities. It can affect one lower extremity. It can affect either upper extremity. It can be in the abdomen. So it can really be anywhere where the fluid is going into the body part, but having a hard time getting out of that body part.
Got it.
And it's generally, when you have fluid after surgery, you're swollen. We don't typically call that lymphedema unless it really becomes a condition where it's chronic, meaning let's say over a year. And we do some kind of workup to test that, yes, you actually do have this condition where you're having a hard time, your body's having a hard time getting rid of the fluid that's going into this specific part.
It's wild.
Is there some surgeries that's more common with others to have a more permanent lymphedema reaction, for lack of probably not clinically how you explain it, but
yeah, no, I get what you're saying. So surgery of the extremity is generally going to have the highest risk because if you injure or remove one of the lymphatics, so you have lymphatics and you have veins, and they can both drain fluid from the body. And so if you damage or remove or cut or injure one of those in the extremity, your risk of lymphedema is much higher, and that's what studies have shown as well. But it's also not uncommon to have, again, I wouldn't call it lymphedema, but kind of chronic or prolonged swelling of the lower abdomen after a tummy tuck, because and you can even get in the lower extremity, because there's lymph nodes and just general channels in the lower abdomen that drain that area and also sometimes drain the lower extremities. So on some patients, we do a tummy tuck and they come in 2 weeks later and they have terrible swelling or fluid retention in their lower extremities.
Mm-hmm.
And we tell for the most part, patients are okay without compression of the lower extremities after a tummy tuck. But in those patients, we will then recommend, well, you know what, you've got to get compression stockings that go all the way down your ankles for a few weeks, and maybe even get some MLD of the lower extremities. That's manual lymphatic drainage, where they kind of manually push the fluid back towards the channels to help get rid of it until your body's then able to compensate and overcome the fluid load.
Yeah, I hear the lymphatic massages can be really one feel good and really do wonders for you. So I've always wanted to get one.
Wouldn't say they're the most comfortable thing I've ever had.
Yeah.
Especially the first few. Remember, swelling is painful. So if then swelling is painful and then you're pushing on it, it could be uncomfortable. But the after effects definitely feel a lot better. And I had swelling in my legs, so we actually went back and added down to the knee compression to see if we couldn't kind of move things along. I definitely had some lymphatic draining issues, I want to say, with almost all of the last 3, I think. But I don't believe I have lymphedema. I do have lipedema, which is fat, which is different. But I do think my body just isn't great in those systems. So it was not surprising.
Yeah, it can't, like I said, it can be, it's going to be different for everyone. Kind of like if you bump your knee, some people get a black and blue bruise. Some people don't really bruise at all. Some people swell for, 5 days, they'll swell for 1. So everyone's body is going to be different, and it's important to you have to treat the patient individually, right? We don't do the same thing for everyone. But certainly if you're noticing swelling of an area, like you said, Ashlyn, in your legs, it's not uncommon if you had a tummy tuck or lower extremity surgery. You just want to make sure you're managing it and staying on top of it.
Which it
And
made
then
sense.
to your
I had compression everywhere but there. So it made sense
right,
that
yeah,
the
yeah,
fluid was like, okay, we can't go to your arms and we can't go to your abdomen, we can't go to your back, and we can't go to your butt. So like, where are we gonna go? Oh, we're gonna go in
Yeah.
your thighs.
your
Well,
thighs, yeah.
might as
But
well.
also, I would imagine the MLD. I've never had it done, but we do recommend it for a lot of our patients. It may not be comfortable during, but really we're looking for the
Yeah, it's
after,
after.
right? So it should make you more comfortable after. And again, as you said, swelling can be uncomfortable and can almost be painful. So the goal is to kind of help remove some of that swelling. It helps your body eliminate that faster. We often get asked by patients, is it going to change my final result? And the answer is probably not. I mean, eventually your body will learn to drain and we'll get the swelling out. I think compression is definitely, if you're going to pick one of the two, compressions are more important than MLD, but it will help you, I think, have a more comfortable recovery, except maybe the 1 hour session where you're actually
Yeah.
getting
And I
massaged and
think you do
drained.
have immediate results. So it is interesting. Like if you take a before and after, which my lady always did, like you
Hmm.
could see she was moving some stuff even in the hour that I was laying there.
Hmm.
I think the like downside, like good and bad, is you need to get them more often than like a regular massage. You can kind of do one if your shoulder's messed up, and like sometimes like that fixes the shoulder. Where this was kind of a continuation thing where I think I did it like 2 to 3 times a week. She came to my house, which was really convenient.
Nice.
And so like that was helpful. It also like it felt good to have some socialization and someone to, that came in who knows a lot about what's going on, who could be reassuring to like, I see this all the time. Like I was kind of freaked out by my legs and she's like, She's like, it makes sense. We're squeezing everywhere but there. Where else is it gonna go? She's like, it didn't go to your calves. That's great. She's like, I get some people to get like their
All
legs
the way.
get so heavy they have a hard time like picking them up. So she's like, it's not impeding your ability to walk or move. She's like, it looks kind of crazy. She's like, but it's all good. She's like, and she knew the lady who did the faja, the compression garment, and so she's like, just have her, sew in some longer shorts. And so I did. We went back. She ripped out the shorter shorts and then made longer shorts. So I had longer compression. So there wasn't like a cutoff point because that's
Nice.
kind of what was happening. Is
Yeah.
creating like a cutoff point, like say like 3 to 4 inches down my leg. So it
Mhm.
then was causing this kind of like, and
I was
so
gonna say sometimes you go lower and then the swelling just goes,
it's
generally
going,
your
yeah,
swelling's gonna go past the compression. So even if like, when we do thigh plasties or thigh reductions, for example, we try to get patients to get compression all the way down to their ankle, then their foot swells, right? I mean, you're kind of in this constantly chasing this thing where you're trying to get the swelling out.
Yeah.
And I
Um,
had some like travel socks, so I tend to travel
mhm.
when I go international, uh, just to do it. I have compression socks for traveling. I used to use those too when I just worked really long hours on my
I
feet.
need to wear mine.
Uh,
I need to get some for my travel because I do not.
We, yeah, I
And
wear
I
them
can
all. I wear
tell.
them if I take a flight more than 3 hours,
Yeah.
pretty
I
much.
usually go when I
Almost
go to
every
Europe, and I
one.
always have a friend if we're traveling together where both of us will be like, "Did you put on your?" She needs a little more help, but I'm like, "Okay, I'll help her put on hers, and I'll put on mine, and then if one of us reminds each other, then we will do it."
I make my
Um,
wife do it and she hates it, so
Mhm.
they're not the
every
most
time.
fashionable things there ever were. Even
Well,
the
and
fun
it's
ones. I have some
really
fun
good for
ones.
your body, like, and comfortability. Like, it does suck. Like, I know, like, after I get off the plane, if we have a lot of walking to do after the plane, like, my leg just feels a little heavy, And it's really my left leg the most because that's where I have, like, the metal in my left leg. Um,
Mm.
so I'm like, I can really, like, tell the difference. But as long as I get my legs up within like an hour, I'm fine. I just need to get my leg up. And I also have that massager roller that I use while
Mm.
traveling, which I actually use at home too now because I'm like, why not? Like, I keep hearing benefits of having your lymphatic system drained that I'm like, this is crazy. Like, let's just use it all the time.
I mean, you bring up an important point, right? So you had this trauma however many years ago on your leg, and I would not find it unusual if I think you've just been saying, without maybe saying it, that you find more swelling on your left side than your right. And so, I mean, that's the same with surgery, that some of those changes can be permanent or lifelong.
Yeah.
And so you just have to manage them.
Oh yeah, just looking down right now, like it's just a little bit. It's always just a little bit bigger than the other one.
Bigger, yeah.
But yeah, I think so. Like when you think of support, I would also remember that may also look professional, that may also look medical, beyond like traditional support, where we think of it like a spouse, partner, friends, therapists, mental health professionals, peer support, other people who've had skin removal surgery, whether that be online or in person.
Yeah. Well, because I've recently had a few people go through surgeries, and they all get like this blues, like this.
Okay,
Yeah.
so I did research about my
The lack
comment
of
last
sex.
time.
Yes.
You remember how I made that comment about where some people who self-harm get a reaction? That does not happen in surgery, because the way anesthesia works, your body doesn't view it the same as it would a cut that it doesn't know where it came from. So when I looked it up, it said that is not what it suggested. More when people get the blues, it has more to do with like that they don't immediately look like how they thought they were going to look, and sometimes
Oh
you
yeah,
actually
I can
look
believe
worse.
that.
Yeah.
So unrealistic immediate expectation, like not understanding how long the process takes, and not being able, like we talked about last time, if your gym is your outlet, not being able to be able to work out if that was your outlet, but more so you can't socialize the same for a while. You can't leave the house potentially. I had a couple of mine, like I couldn't drive for a while. When I got my arms done, I don't think he wanted me driving for like a month or two. It's really
Yeah.
long.
Oh, that's a long
Um,
time.
I essentially didn't want me to have to make a sudden
Yeah.
correction,
Yeah,
which is fine at the
get a
time.
Tesla.
I took like a month
Yes.
off. So there you go. Have your self-driving car drive you.
Yeah.
But yeah, no, it was maybe it was, I think it was 30 days. His biggest concern is he didn't want me to make that might have actually been a more recent one with my armpit incision.
We usually say 2 weeks for driving, unless you're having, and again, everyone's going to be different, but we say 2 weeks for pretty much anything upper body or a tummy tuck. But if I'm doing like a lower body lift or thigh-plasty, I usually tell patients to plan for 3 weeks.
Okay.
Yeah, because again, you just
But
don't
I
want
think some,
sudden
I think
movement
so,
or
some, yeah, and I think some do drive before the 3 week mark, but I always tell patients plan for, like, it's kind of like taking time off work. Again, for a lower body lift or thighs, I'm going to tell them plan for 3 weeks off, and if you feel fine sooner, we're certainly happy to give you a release letter back to work as long as you'll go back on light duty. But I always tell them your boss is not going to mind if you take 3 weeks off and go back at 2, but they're usually not going to be happy if you ask for 2 and then at the second you're like, I need another
Yeah.
week off.
They
So
don't like that.
yeah.
So.
yeah,
I
plan for
generally
more and take
took
less.
about a month. I know I took a month off for the first 3 way back in the day. And then the most recent ones, I did one in December, so that worked out beautifully, even though my surgeon doesn't like doing surgeries in December. I did at the beginning of December, so I took like 2 weeks off, and then the last 2 weeks of the month I did telehealth, and it was like super slow. It's like one of the slowest times of the year for us. Good intention, like people want, like I intend to go to therapy, and then they connect and they're like, I'm at a Christmas party, and you're like, so we're not doing therapy today. So I've stopped like making appointments unless there's like something critical going on the last 2 weeks. And then the other two, I think I took like 2 weeks full off, though sometimes I have clients that just like changing their schedule or whatever. I have one client in particular who's elderly, and like I literally, I think saw her the day after, like one of my, just to like not disrupt her schedule. And I just kind of propped myself up in a way that she couldn't even tell. So
That's sweet of you.
I don't take meds or narcotics, so I wasn't like loopy. I'm sure I signed something saying I wouldn't do anything for 24 hours, included like legal decision making. Probably was over 24
Yeah.
hours by the time I saw her.
We don't recommend signing anything legal for 24 hours after anesthesia for sure.
Yeah, I was fine. I mean, in the end, but
It's not the time to revisit your will.
right.
No.
Or someone tell you a great business idea. Though I do think after one of mine, I did like, because I was really bored and I was sitting there, I think I did create a new part of my business after one of my, which I remember laughing at, because I was like, you're not supposed to do things. But I just not had that much time to sit and do nothing.
Yeah.
So like by this, 24 hours out, I'm like, all right, what are we doing?
I think that's the hard part about like working from home, is that like you can work any time of the day. And so it's like, for me, I pretty much was realizing like I'm working from the time I wake up to the time I go to bed. And it's not like constant, but it's every hour of some sort. You know what I mean? Like it's just a little bit here and there. So I'm wondering, for those that work from home, for their support when it comes to work, like, it sounds like they're able to get back to work a little bit earlier. Do you sign them off early if they work from home,
Hmm.
or do you just always do 3 weeks?
No, our work from home people, because you know, those are obviously light duty unless they're like lifting packages at home, but most of them are on their computers. Um, Again, I usually tell most of them a week or two, depending on the procedure. Like arms alone, I try to recommend arms specifically because when you're going to work at your computer, you're going to have your arms below your heart level. So
Right.
2 weeks, we try to really recommend that and push that. But like chest, breast, back, tummy tuck, usually at a week you can be working on your computer. I did have one patient who had her arms done, um, and she had her spouse set up this like super elaborate. I've kind of seen them at
You
like
could lay
people who have like
down.
yeah, some like like those screens
Yep.
are like curved.
Yeah.
Cool.
And you have this like fancy chair that you almost lean back in, and her like keyboard came down from the ceiling. She did it with her arm surgery and like a thigh, like a leg surgery, so she could have her legs up. And she was back at work in a week after both those
Holy
surgeries and didn't
shit.
have yeah.
Something you do have to take into consideration, which I think a lot of people forget, is how well are you sleeping? Because if you're not sleeping well, you may not be functioning on all cylinders. And I tell people, same thing for bariatric surgery. If your job requires, even if you work from home, your job requires potential life-threatening questions and answers. Like, I had a lady who was like a nurse, but she like worked from home, and we were talking about in bariatrics. I'm like, you may want to give yourself a little time. I don't want you to give the wrong advice over the phone or the wrong
Hmm.
information, or you're talking to a patient and you're just getting confused just because you're exhausted. And especially after bariatric surgery, when you're not allowed to eat a lot, or not allowed, you're not able to eat a lot. Like, your energy level for some people is really good, and for some people it's really terrible. And so I always tell people, like, what does your job entail? And like, if you made a mistake, would you be fired? Could someone die? Like what is the level to which decision making like could come back on you? Specifically in bariatrics, I have clients that like get really tired after, like, they'll try to work and then they can't drive home because they're just so, because you're getting in like 400 calories. Like, you're
Right.
doing your best, but you're just not getting a lot of food in. And I know not so much post plastics, but I do think, like, if you're not managing pain well, or you're not, I had one surgery where I was just getting a lot of the lightning stuff
Oh,
at like 2 or 3 months out, and I just needed to be on gabapentin a little longer. But like, every time I try to come off of it, it just like would get worse, and then the next day I'm, like, couldn't sleep. And
function. Yeah.
so I think, like, our best bet is 2 to 3 weeks, but you're not a failure. You didn't do anything wrong if you need additional time. I mean, I've had people who needed a bit more time after that. Just
Well, and I
Yeah,
was,
depends
that's
on.
a great point too. Obviously, what you do for a living is, as you said, very important. We definitely don't want to send someone back, who's um, a lawyer making big, decisions about something at a week after surgery if they're not going to be okay
yeah.
going
Lawyers
back.
are
So
as bad
absolutely,
as
that's a great
therapists, and they will. So we
point.
have to
Oh, they
help
want
them not do
they
that.
can't help themselves. It's insane.
Doctors, lawyers, and therapists, we are not the best at taking care of things.
Mhm. Well, and so when I had my bariatric surgery, I worked for the state of Oregon. I was handling your guys' taxes. So there was, and I had an authority limit of how high I can go for garnishing you. So if you weren't paying your taxes,
That's very powerful. I love that you had that
Mm.
position at like what, like in your like late 20s,
let's
early
see.
20s.
Yeah, I was 28. It's 28. Yep, 100%.
It's like, this
Um,
man pissed me off. I've got to shake all of your wages.
I would do it responsibly, but they would definitely get it maybe a little sooner. No. But that was kind of the thing about the surgery though, and I talked to my boss about, was because I do have some authority here, like, I don't want to fuck anything up. And that was always my thing. I was like, I just don't want to mess anything up. Like, these are people's lives. These are, like, this is my job. Like, I don't, And then even when Eric went through his stuff, like, I was working with attorneys, and then my settlement value, like, I can eval you up to 50,000 was my amount. So I could do that, send it over approval, and get it done in like an hour or two. So that's where my, like, I had a higher authority. You don't want me sending out checks, you know, like just
Oh, that sounds like a sad story. 50 for you. 50 for
50
you.
for you, right? Like, you know, I got swindled one day or something because I'm like emotional. And yeah, like that's why they were so kind to let me be gone for so long, because it's like, yeah, we can't really, you know, it's risky. And you have to think about that, like when you're doing your surgeries, like making sure you have enough time. Think about it mentally. Yeah, maybe physically you can do it, but think about that mental part. Like
Hmm.
Ashley was saying, with that sleep, it's huge. And it's
And
just
so
like, it's not worth it.
for some, so to that point, for some patients, depending on what they do, sometimes I will suggest to them, you might want to go back, kind of like if they're like, well, I want to go back in a week, I don't have a lot of time off, we'll either try to recommend, kind of push them towards, well, maybe delay it then until you've accrued more time off and then you can take a full 2 weeks, or consider going back part-time your first week or two back, right? So then you're not taking so much PTO and you can still go back to work and do like maybe 4 hours a day. That way, maybe you've got 4 hours of mental and physical energy and then you're kind of burnt out.
I
But
like
you can
that.
do that for a week or two. Yeah. So we try to work with patients depending on what they do.
Nice. Ease it on in sometimes, guys. Like, it's
If
okay.
someone has a ton of time off, so I worked for the state of Florida, and though we got paid nothing,
Hmm.
we had so much time
A lot
off.
of
It was
PTO.
insane. Yes. So part of why I took a month off when I had bariatric surgery is because I had like 6 months of sick PTO, like hanging.
Oh,
It wasn't even regular. It was just sick, just hanging
Ah!
out. Yeah. Well, you were like, right. I mean, I don't know
the
if you
true,
were.
if you don't use it, you lose it.
Yep.
Yeah.
Or they'd only pay us a quarter out. So like there was no point. Like there were a lot of
Yeah.
people that like were sick the month of December every year.
Oh, right. Yeah, it makes sense.
Oh, we
That's
missed
why nothing
last
gets done, I guess.
the day after
No.
things the day after Thanksgiving. The state of Oregon employees basically missed it enough that like they're like, why are we even trying to make you come in this day?
The
Yeah,
governor would
it's a
always
hard.
give us that as a holiday, but he would have to tell us that he's amazing. I worked under a particularly challenging governor, and he loved to tell us how amazing he was while he was like gutting all of our retirement. And like the only thing you got as a state of Florida employee was like a decent retirement. And then he was
Yep.
like, "Meh, we should keep up with like what they do in corporate. You shouldn't get all that retirement." Yeah.
Ugh.
Pretty sure most hospitals I've seen now also, like the clinics and offices close the Friday after Thanksgiving, just kind of, I'm sure for the same reasons you guys just mentioned.
Yeah, I'd say outside of banks. Like I had some clients who worked at banks, and that is one of the busiest days because there's so much consumer spending that day. But like, yeah, outside of banks,
Mm. Oh, that's Black Friday. That's right. Yeah.
Yeah. Yeah.
which is
Banks are
in
open that
general
day?
like,
The
a
call
lot of.
centers are. I used to work it, and that was the whole thing. There's a limit. There's a spending limit on your guys' cards, and they would call, and then I would be the one, because I was what we called a PSR3, which is your like personal reps, like the third level, whatever. And so it would get to me, and then I would be the one, like, you'd have to be like at the cashier, ready to swipe, and I would let you just do that one last purchase, and then he would go through, and I'm like, you're done spending for today. You can't do anything else. Like,
Hmm.
so yes, there is people just for that, guys. Just FYI.
That's crazy.
Interesting.
But back to
Yeah.
support. I think you just make sure you have a good work support. Like, so talk to your bosses about what you're doing. You don't have to say what surgery it is. You can just say, I'm having surgery, blah, 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 blah. I need this X amount of time off. Just make sure, everything is going smoothly at work before you go, and check in with everyone.
Yeah. And I
Yes.
think there is case law surrounding like skin removal specifically as a, at least in the state of Florida, there is about that being medical and not solely cosmetic.
Oh, good.
So like if your job had a feeling about like sick leave versus vacation.
But I don't do the FMLA paperwork. Thank God we have people in the office who do that, because that'd probably take like half a day a week. But I don't think your employer can ask what you had done.
Correct.
Correct.
I
But
don't
if
know if
they
that's, I
found
think that's
out,
like, yeah, but they wouldn't find out. I mean, like, so we are I mean, we don't we can't even disclose what a patient had done, right? We just say you had surgery on this date. You need to follow up X amount of times in the first six. I mean, it's vague because again, we are bound by HIPAA So I don't
Right.
think
What
that's
if
a
they
state specific
Googled
thing.
to see what kind of doctor you were and they're like, I think you need this.
Potentially. I mean, but they don't know what you had done. I mean, you could have had a, and they can't ask you,
Right.
or maybe they can ask you, but you definitely don't have to tell them. Um, I'm not sure
Yep.
they're allowed to ask you, but I'm 100% sure you don't have to tell them.
Yeah, no, there's a interesting case law. It's probably from like mid 2000s, late 2000s, and they sued the pants off of their employer. They're having skin removal, I think after mass weight loss, but not necessarily bariatrics. I can't remember which one it was, if it was or wasn't. But
Because they're like,
the employer was making them use like vacation, deeming that it wasn't
Mm,
um, medically necessary, which is not your employer's call. And
hmm
I think they had a
oh,
complication, and then they had to continue, and they refused to let them use sick, and then they were fired, and then it ended up being litigated through like a employment
Oh,
law. But it was just an interesting. I remember reading about that, and I'm like, it never occurred to me that it wouldn't be.
I
So
remember being nervous about that when even just getting bariatrics. I was like, are they gonna like make me take vacation time? And I remember asking my boss that, and he goes, no. I was like, okay. Like, I didn't know how, like, because technically it's elective, whatever. So I was like, does that mean that I don't get to be able to have the surgery? Like, and he goes, no, like, that's why we have FMLA and we have all these things in place. Like, I was like, okay.
hmm
Because I'm like, I was like, do you guys get to tell me whether or not this is, like, allowed? And he goes, no. I'm like, okay. I was so confused. I was really nervous because, like, working for the state, you're just like, I don't want to mess up whatever I have to do.
it's
So,
so funny because the state is usually the one that's just like
yep.
whatever, because that's a
Yeah,
great, if there is employment law to be sued, the state has lots of money. So kind of think of like
but
the state
also,
versus like an individual employer.
Mel, you wouldn't even have to tell them what you were having done. I mean, you just have to tell them I'm having having surgery.
Yeah. Yeah.
You don't have to tell them what kind of surgery you're having.
Right. Which I didn't realize until after the fact. I was like,
Mm,
This
I
is
had
probably a good support thing too, is like financial support. So if you are self-employed, or you are maybe you're going to go out on short-term disability, and so it's not going to pay you at 100% because you don't have enough PTO saved up or sick time, that you may um, want to look at like financially where you're at beyond just the cost of the surgery, but also if you had to reduce work, or you're a contract worker and you had to reduce contract work, or even as a therapist, I have to look into like, okay, if I reduce my caseload significantly, that's an additional cost that I need to think about other than just the cost of the surgery itself. And that may have to do with timing. So like I purposely put it in times where we're slow. So I tend to in the summer or in the very end of December, because I'm slow anyways, and I generally take time off then anyways. So it isn't a reduction overall when I look at like the year as a whole. But if you're a contract worker who, like, I don't know, works heavy in the summer, then you may want to not have surgery in the summer.
right.
And
Right.
yeah.
Well,
yeah,
yeah.
that is a great point, the financial aspect of it. And actually, so like a lot of our teachers come in and get their surgeries either in their winter break or their summer break. So
Same thing in
summer is usually
bariatrics. Yeah.
summer tends to be very busy for like we have a lot of like teachers who come in and they do they're kind of they're smart. They must talk to each other because I tend to get a lot of teacher consults in like February and March, and they want to book their surgery in June because schools here get out in the end of May. So they're like, I want the 2 months to recover. That's what I'm gonna do this summer.
Does that impact because I know bariatric surgeons tend to vacation at very specific times that are not the times where the average person would vacation. Do you alter like when you vacation, or it doesn't matter?
I don't. I didn't think bariatric surgeons like they all vacation at the same time. That can't be right. Unless it's like a meeting, maybe.
Well,
I could
no,
see that.
they tend to vacation outside of busy times.
Yes.
So
Yeah.
like it's dead in the summer, so that you'll notice that there's certain times of the year where they tend to be on vacation. Like I wouldn't go and do like a round where I go and see all my surgeons at certain times because they're more likely to be on vacation. So like November, December is their super busy time, but like no one wants to have surgery in January, so a lot of
Yeah.
them vacation in January because nobody's hit their deductible, everything is restart besides Medicaid, which pays the same all the time. So like some of our hospitals will do like a lot of Medicaid cases in January, February, because there's no deductible start over or anything like that. But But yeah, it is
I
funny
think,
because they vacation different.
yeah, so I would say it's pretty similar for me in the sense that January and February usually are slower, even though we don't really talk about deductibles for a lot of the self-pay work. But I think patients, I don't know why every year January does tend to be slow. I think it's the holidays. People tend to, eat more than they thought they would. Like, let's say a patient had booked surgery in January back in like November, October, for example, and they're at their goal weight, then the holidays come and they eat a little bit more than they thought or gain a little bit more weight than they expected, and then they're like, I can't do my surgery now. I've got to wait. Um, yeah, I don't know if that's the only reason, but I think deductibles, if you're doing insurance work, definitely have to do with it, where patients just don't want to start their year off by paying like three or four or five, whatever $1,000 towards that. Um, so yes, it does tend to be slower. I don't tend to take off in January unless like, we have an event or something or a meeting we're going to. I personally just take off when I need to
And
or when I
you
want
guys
to.
don't have any like, what are they, residents or students that are, like sometimes people say don't have surgery like in July when like all the new residents come on because
Yes,
they're like all brand new. But if you have it in
Oh,
June, they're like almost fully like out of there. So like June's a better
correct.
month than July. Do you have any of those with
Yes,
you guys or no?
no, we don't. I mean, occasionally we do have students or residents, but they're definitely not the ones doing the operation. It's more just to educate. Um, They might be helping close, like close an incision. They might be helping retract, which is like kind of hold things for us as we're working. But they're definitely not doing the operation. Um, and they could be either a surgery resident or they could be, sometimes we have like PA students or PA, we have like a PA fellowship, that's a physician assistant fellowship or nurse practitioner fellowship. So sometimes we do have some of those around coming to learn. And then occasionally we'll have observers who are just people in the room watching and they're not even, they might scrub in, but they're not doing anything other than just trying to see a surgery and learn. Sometimes they're people, students who are in high school and want to go to medical school or medical students who might be interested in plastic surgery. They're usually just there watching and observing. Sometimes they'll cut suture, but they're not really doing much of the work or any of the work at all.
Yeah,
So
because I had my bariatric surgery in June, and I was one of the last surgeries that what would that be, a fellow? If they're at the very end.
if it was a yeah,
Bariatric,
that would
it
be
was
a
a
fellow
fellow, right?
probably.
So he was like
Hmm.
super excited because he was actually going to do some stuff, and I hadn't really fully understood he wasn't the surgeon. And
Yeah,
so he was like talking very excitedly, and I'm like, "But you're gonna do the whole thing?" Like I was like so confused. He's like, "Oh no, the surgeon's gonna come in next," and I'm like, in my head, I'm like, "Who are you?"
what? Yeah, like
You were the surgeon. Oh, he's like, "Oh, I'm one of the surgeons." He's like, "I'm at the very end. You're like one of my last, so I actually get to do more in yours." And I was like, "Do a good job."
mhm.
But
yeah. I
again, it's
mean,
like in a
generally
month
the
he's going to be a full-on bariatric. I mean, he's going to be doing them completely on his own. So
Right, and then
Yeah,
don't forget if you're a bariatric. So there's a difference between a resident and a fellow. I feel like we've gotten totally off topic here, but
that's okay. We'll bring
just
us
to
one
wrap
back. Don't you worry.
Just to wrap that discussion up, there's a difference between a resident and a fellow, right? A resident, and there's 5 years of general surgery residency, which is that's where you might do some bariatric surgeries. You're not doing a bariatric surgery in your first or second or maybe even your third year of residency.
Okay.
You might do it as a fourth and fifth year. And then as a fellow, even in July, you've already done 5 years of general surgery at least. So I would imagine, unless you went to a program where there was no bariatric surgery, you've at least done some. So even in July, it wouldn't be hopefully your first. And if so, the surgeon's not going to let a fresh fellow just, come and do the whole case. So everything's kind of like a step by step. Okay, now I know you can do this. Sometimes it's, I want you to get into the abdomen and then I'll do the rest, and they let them do that 5 times, right? Then they'll let them do the next step, then the next step. So it's all kind of a graduated approach. You're not just going to let someone fresh in July 1 come in and do the whole bariatric surgery.
Well, that makes me feel comforted that there's not just willy-nilly. Well, and also like you guys are all certified. Like it's not like you guys are like not allowed to do surgery. So, I mean, you know your shit, especially if you're at that level. But back to support where it
Hopefully.
comes from. Like, I think we should talk about social support because online is really helpful for those that are like stuck at home and they also work from home. And they're not connecting with their bodies because that's what I've been hearing is around like month 2 or 3, they just don't connect and they don't know what they did. They're just kind of like, why did I do this? Or maybe it's a little sooner, but I do know like that's happening.
Sooner probably
More
than
like
2
a
or
month
3
out.
months. Yeah, I think when swelling and things don't look like what they thought, I think there's a lot of people who think they're going to wake up from surgery and look the way they're going to look. Even their hope is they're going to look like, I don't know, 85%. And sometimes you wake up and things have not like settled at all, and your scar may look crazy, and it hasn't flattened, it hasn't done all the things it's going to do. Your belly button may look crazy, but I think that it's interesting. I think there's a lot of excitement in the beginning for a lot of people, especially mass weight loss people who have skin removal surgery. And sometimes that does wear off, especially if they're getting frustrated, like the swelling, or they're staying up, or they were hoping they would see a certain result by now, or they're having a hard time like realizing this is not the final result. I think that's probably the thing I talk about the most in therapy. Like, this is
That
not what you're going to look like.
that's huge. I mean, and I think the way I try to tell patients is I don't even think or consider about any kind of revision until the 3 month mark because so many things change and shift and settle and swelling that we just talked about. I think to look at a result sooner than the 3 month mark and talk about fixing something is way too early.
Okay.
That's not to mean that sometimes you won't tell, like maybe at 6 weeks, yeah, this might need to be revised. We might need to do this, we might need to do that, but I wouldn't consider it, I wouldn't really consider it or make a final decision and this is the soonest would be the 3 month mark. But speaking of swelling, I have two stories. I had one patient, we had done her tummy tuck with high def lipo, and in a week she comes in and she's like in love with her result. And I'm like, like you look, I mean, I didn't say this to her, right? But I'm thinking like you look terrible. Like you're swollen, but I'm like, you kind of like take care of it. I'm like, okay, if you're happy, great. I'm not gonna I'm not gonna be
Yeah.
here to burst your bubble. But if you think this is great, wait till the 3 month mark, right? Um, and it's funny because even my nurse practitioner, I can't remember if my nurse practitioner PA saw her that day and she came out and she was like, she's in love with her result, but she's like, she's super swollen. Um, and so, that was kind of a funny thing because usually people are, as you were saying, Ashlyn, depressed or unhappy, or they're like, where's my definition? Where's the lipo you did? I just see a bunch of like bloating. Um, and then on the other side, I have a lady, this was a little bit more recent, but I had a lady, we did lipo 360, we did radio frequency, we did Vaser, ultrasound assisted lipo, tummy tuck. And then she happened to have a seroma, which is a fluid collection that we think got infected because we had to put her on antibiotics. So this was at about 3 weeks after surgery. So she kind of like almost blew up like a balloon, which happens generally when you add all those technologies. I tell patients expect swelling for 3 months, easy. Um, and so she comes and sees me at the 6 week mark, her infections is cleared, her drains are out.
Nice.
But she's like, I still feel swollen. I was like, well, yeah, you're still 6 weeks. B, you had an infection, which kind of delays the swelling. You've got now more inflammation as a result of that. And I told her, and we use all this technology. So I told you from the beginning you were going to be swollen for about 3 months. But every visit she comes in, every week we see her, and she's like, why do I, like, where's my results? So you
That
definitely do
person
have
is
to be
going to have to
patient.
struggle.
That person's going to struggle. And I do think, just based on her other medical history, she has a higher risk for lymphedema or just kind of poor, delayed drainage of fluid from certain body parts. And so she's someone who could have swelling for 6 months or a year. Again, this is probably, the smaller majority or smaller percentage of the population, but based on some of the other things we know about her medical history, I wouldn't be surprised, and I told her this, that she could have swelling for 6 months to a year before she really sees it subside. But I bet she'll still be asking at the 3 month mark why she's still swollen. But again, those are kind of two different funny stories, or not funny, but interesting stories.
Well, and I've always been told the swelling will, I've heard someone tell me once 3 years, and I was just like, what? That seems insane. But then, like, I hear more about like 1 year marks. I've never heard this 6
It's
months. I've
weird
always heard it
because
take a
it'll
full
go
year.
for like months and months and months, and then you'll see yourself one day and you're like, oh, how about that? the final results are here. I don't know. Like I had that at every surgery I've ever, or skin removal I've had. There's been this weird point like months and months later where I'm kind of like, oh, like the swelling is finally down. This is what the final results or the current result is going to be. Yeah, it's interesting though, because you hear that, and you're
Yeah.
like, okay, I'm going to have a lot of swelling. I was thankful that like every time I woke up and I looked at anything, I'm like, oh my God, it's gone. I'm so excited. I remember my surgeon was like Ashlyn, don't get so excited. Like we have so much more to go. I'm like, I don't care. It's all gone. I can't like move it all around. Like it's great. I'm happy if nothing else. And they're like, you're really swollen. I'm like, don't care. Really flat. So swollen and flat. One plane and a belly button. We're doing good.
3 years is definitely, I would say, an exaggeration. I mean, there might be people who, they tell you they're swollen for 3 years. I mean, for example, some patients get numbness in the lower, well, everyone has some degree of numbness, especially initially in the lower part of the abdomen after a tummy tuck. Again, that can be permanent because we're cutting out tissue, right? So some of the nerves there might just be gone permanently. Some patients get sensation and it sometimes takes about a year, and others will tell me it's numb forever, and then others are like, well, it was numb for 8 years and then suddenly I got sensation back. So, the body does weird things. I think 3 years is probably a bit of an exaggeration. I think for, 98, 99% of patients at about a year, you're going to get what you get.
Okay. So 1 year.
Yeah, I definitely never went over a year.
Okay.
Yeah.
And I would say that's the same for surgical stuff, because like on my leg where I got stuff done, like I don't feel, those are like numb spots, so it's like, I feel like it's pretty common when you get any type of surgery. So just.
Correct.
Yeah.
Yeah. I mean, if you make a cut, even if you don't remove tissue, if you make a cut, you're cutting through, nerves somewhere. And some of those will be those little sensory nerves, and sometimes they just they don't connect again. And so you're going to have numbness in that area.
Yeah.
Yeah, we should probably talk about like what to do if you don't have you have an unsupportive person.
Spouse?
Yeah, like either zero
Or
support
partner.
or the people around you are not very kind and helpful.
Yeah.
But also, I mean, this is like the flip side of that. If you're doing it for someone or for
so let's start with the
intentions.
easier one, which is if you're doing it for someone else, guess what? It probably won't change things. I remember I had a bariatric client that came in and was like just not taking it seriously, and we're talking about like why she's going to do it, and she's like, well, hopefully my mom will finally love me. And I shut my computer and I looked at her and I'm like, here's the thing, hon. If your mom doesn't love you because you're fat, she's going to find something else not to love you for that you don't have any control over, because that's power.
Yep.
So you and I are going to meet weekly for a little while so we could figure out how we're going to manage this. But if that is honestly why you're doing this, you're not going to get your goal, because that isn't why she doesn't love you. So, but it is, I do think with, specifically with loose skin, I do have clients that are like, well, I think my husband would be more attracted to me, or I think I would have more confidence in the bedroom. And it's like, okay, let's pull some of that apart of is that a you thing? Is that a them thing? If it's a them thing, what is the level to which? I definitely have had clients who have gotten divorces because their partners were really into a certain body shape that they no longer have. And again, that's a bigger level than being non-supportive as being they had loved you. And also, I think that could be quite soul-crushing for a lot of people. You loved me because I had a certain body type and that I don't anymore. And what does that mean about me? Even though in therapy, we talk about how that's not a you issue, actually, though it feels like one, which I always find fascinating, because I have some clients that will come in right away and be like, this is not, this isn't about me. And then I have some clients that are like, this is deeply about me. And then we have to kind of go into things further. But what I always say when I have clients that come in that feel that their parent, partner, best friend is not supportive is number one, let's have a conversation about it with that person. So sometimes we have to talk about what this is actually about, because for some of our support people, they may say, you're not vain, so I don't understand why you're chasing this vanity. And so oftentimes then the conversation has to be actually, this is about function. This is about, I would like to wear a bra. I would like to be able to wear pants. I would like to run. or exercise, or I would like to feel whole again. And that doesn't actually have to do with vanity. That has to do with like, and it may not solely be function. It may also be like you're trying to put yourself back together from a mental health standpoint. I think a lot of people, loose skin makes them feel like they've done this to themselves. It's a reminder of the damage that they have done to themselves. And by removing it, it can help kind of be like, I feel more whole and put back together. And they may not, again, like there's many layers of this.
I'm kind of that last one because like, I know I want to almost like work off, sweat it out, whatever I have to do to get the old Mel almost gone. And then now I'll introduce plastics. So now I can be like, okay, literally it's start over. So now with your body, and now you know how to do all the things. Like now you're in charge of how this outcome goes. Because right now I'm chasing this whole like, oh my God, I did this to myself, I feel like, and I'm trying to lose all the weight that should have never even been there in my head is kind of where it goes.
And it's interesting because I never thought that I would get my arms done. My arms bothered me, but I was like, I'm kind of like here, there. It's actually more like armpit. The issue actually of loose skin was more in the armpit. But what I figured out is after I had gotten my upper back and my stomach and everything, kind of the skin removed there, my arms were the last reminders and alert to people around me who had never known me as heavy that I previously was an obese person. So for me, like being able to get my arms done specifically helped me feel like if I wanted to share that part of my life, I could, but I wasn't showing it without saying anything.
Mm-hmm.
And that's an interesting position because I don't think a lot of people kind of understood that aspect of it or why that would
it's powerful
cause a mental reaction. But like, I meet a lot of people now who are like, I can't imagine you as obese, or I can't imagine you 140 pounds heavier. I can't imagine. And I'll show them a picture. I'm like, I very much did.
It was.
I really was.
Yeah, I really was. And people
Not
are like, you
lying.
look like a different person. I'm like, I actually think I just look like me smaller, but I do get the majority reaction is like, you don't look like you, which I think I do. But obviously I've also had a lot of skin removal to change my actual, like the contouring of what my body looks like, which was important to me because that had always been an issue for me, surrounding like femininity and like what that looked like for me. And again, that can be different for different people. And part of this process may also have to do with that. And again, to have some of those conversations, and it may be really helpful to have those conversations first with a therapist and like think about what you may want to say or how you want to explain it. Or sometimes too, like I'll play the, spouse or parent or whoever, and be them and kind of come up with weird or mean questions. And then we kind of talk about like what could be your response to that. Remember, like body language is part of a response, and kind of talking about some of those things. And I think also kind of depends on who it is. Like the conversation with a parent, if you're an adult, is going to be different than a spouse, that may be different than a friend. Like I had a pretty supportive friend who, like, I sat down and she was like, I think this is getting ridiculous. This is now the sixth one you've had. Like, when does it stop? When are you going to get it? And I was like, okay, so like, let's actually talk about this. Like part of this is financial. Like I couldn't do everything at once. Like, so the 3 that I had, like part of that was because yes, I could have probably had less. And, also I had 10 years ago and then at 3 now. And I know for my body, I often need revisions and things don't do what they think they're going to do. And like, I knew that going into it. And so like when her and I had a conversation, and I also didn't take it personally that she was essentially saying, I think you're addicted to plastic surgery, where
Right.
I like really listened to her concern and I thought about it. I'm like, yep, on paper, that probably does sound like a lot of elective surgery to remove skin. So let's actually talk about it and actually like let me talk to you about like what this actually does for me, especially when it comes to function. I think there was another level with that particular friend because they are in a larger body. And I think sometimes when I am working on my goals, I have people in my life that feel like I feel differently about them. or how they should live or have their bodies be or whatever, which is separate from what I want for myself. And so again, sometimes we need to have some of those conversations. I'm not saying to anyone else that you aren't done or you haven't done the whole thing unless you have skin removal surgery. But I knew for me, like I needed to have those to be able to mainly be able to function better, like in the world.
Well,
But there
I
was
think
that mental health too.
it's a little frustrating when friends and family actually talk like that. Like when they're like, thinking, oh, well, I think that you are judging me about what I eat because you're smaller. I judge that I'm judging you because you're not working out or whatever it is. And like, I'm not doing that. Like, that's on you. Like, you have to look inward and realize that like I'm literally just being me and just trying to get my goals. So unless I'm not that person that's preaching to you, then we're fine. Like, remember, you can do whatever you want. I'm still going to love you for that. Like, that's the part they need to hear is like, I will still love you regardless of what size you are. Just because I change my size doesn't change my love for you. Because I think that's the part, like, they start getting scared and freaked out that like, oh no, they're not going to love me anymore. They're not going to be kind to me anymore because they're in a smaller body. But it's like, no. It's still big girl up here or big boy, whatever it is.
And sometimes that's where the spouse is coming from.
Yeah.
You're going to get all hot and leave me. And it's like, all right, well, let's have an actual conversation about insecurity. Like, let's actually talk about like what that would look like or what, because the behavior that they're currently doing may actually be the driving force for you to leave versus you just changing your body. So again, and it's like, how can we have those conversations really constructively to be like the non-support that you're showing me now makes me more not want to be in this relationship than, your fear that I'm going to go find someone else.
Yeah. It's actually your fear that's pushing on us. Now we're dealing with that instead of just dealing with what it really is. Like, it does cause a little more chaos. So,
But we hear that a lot. I mean, and you two are kind of sharing that maybe you've experienced it, and definitely Ashton sounds like you've had patients who have. I mean, I I I honestly probably don't do a great job talking them through it. I mean, a lot of them will tell me like, yeah, my friend, tells me I shouldn't do this, or my husband's like, you're being silly, or my mom, whoever it is, sometimes it's multiple people. Um, and I mean, what I tell them, and again, I don't spend like 20, 30 minutes. I'm not like here to be their therapist, but I tell them, if you're doing this for you, then this is the right decision. But if you're doing it for someone else, then it's not. And I do tell them, we hear it fairly commonly that we hear friends or spouses or whatever. But if you feel like this is the right decision for you, then I tell them like, don't listen to that noise. And we do hear a lot of the, well, my husband thinks I'm not husband. Usually it's not the husband. It's usually like the mom or the sister or whatever. So a good friend tells me I'm being vain. And again, we kind of talk through that for a few minutes. But I don't know, Ashlyn, if you have any advice for people who might be hearing that from, loved ones or close ones or friends, for example.
I think it's like you have to assess like, is this worth a conversation or not? And
right. Is this a close friend or is that what you mean?
Yeah.
Like if it's like an acquaintance, like it's probably not worth
or even
engaging
if
them.
it's your spouse during a fight. This may not be the time for us to have a deep conversation about this.
Thank you for bringing that up. It's all about timing, guys.
Yeah, but also like now I know that this is something that's actually bothering you, but now when we're calm and we're in a better place, we can have a real live conversation about it and I can understand your concerns and your fears and all that good stuff if it's worth it. I have clients that are like, hey, I'm on the out and out on this relationship anyway, so like let's dig a grave for it. And I'm like, okay, great. So like not worth their time. They don't really care. Or it's, their nosy neighbor, their coworker who overheard them on the phone and like, those are not worth your time, and even some friends, like not worth your time. Now, if it's going to be the person who's going to take care of you after surgery, yeah, we probably should have a conversation because I don't want to know that 3 days in where they're fed up and they leave you by yourself when you're not supposed to be because this is your fault and you're vain and blah, blah, blah. Like, who's our backup person? So, like, I had a client that we were a little concerned that was going to happen. I said, all right, like, let's figure out who your backup people are. She's going to do it regardless. She really could care less how he felt about it. Obviously, some deeper things going on there. But it was like, okay, so let's plan for this. Like, what are we going to, like, who's your backup person? Where can you go? How can you get there? Are you going to stay at your home? Or even, like, my husband and I are great, but like I don't always do great after surgery. And so like I stayed with my mom one time because he was doing something really important in his life that I was like, me being up and rummaging and
It's not going
being
to be
up and down on the couch like is not good for this timing. So I purposely stayed with someone else. So again, and it's like we had a conversation about it, wasn't taken personally. It wasn't like I can't rely on you, like nothing like that. And again, sometimes those conversations need to happen because you may be partnered with someone who like would take that very personally, that you don't think that they could care for you and that you went and stayed with your mom. So we're going to like preemptively have some of those conversations, particularly if I know a client, like I already know the dynamic is there. And so I think that, like, again, you want to assess like the level of involvement they're going to have, how much say they actually have. Because it may also be there may be like a financial tie to it. It may be that you're a stay-at-home mom and your husband's income is actually part of what's paying for it.
Yeah.
And so maybe that's the dynamic that is the problem. And so how can we, so I like one client that we came up with like, okay, like we're going to bring in some reinforcement. We're not going to negatively impact like how the household flows, because I think he made it more about like the kids. Like if you do this now and it's going to impact the kids' schedule and this and that. I'm like, okay, so like let's answer the concern. Let's take it for face value as a concern and not them being a pill. And like, what's the answer to that? And how can we have an adult conversation? And if the answer to that is I figured it out and the answer is still, then it's like, okay, well, there's a bigger, what's the bigger issue here? I realized that for a lot of people that taking care of themselves in that way may feel somewhat foreign, or that they have a hard time saying, yes, I want this and I'm going to do it. And like, I know I need it, but like, yeah, it would impact my kid's schedule. So we have some of those conversations beforehand. Like, what kind of reinforcements can we bring in? Maybe timing, like your kids go to grandma's for a week every summer to like chill and hang out with camp grandma. Like, let's do it that week. And so, again, like we talked about earlier, like how do we plan back? So it's like, okay, I need my clearances. I need to do a consult. I need to, what kind of level of support do I need or have? And it's also okay to say no. Sometimes people want to offer you support that you don't want. And that's okay also for you to say, I'm good. Or, I have someone who's going to care for me. Or that's great that you found this really cheap person down in Miami that did really good work on you and you really want me to go see them because I'm thankful you didn't die. But I'm good. Like, because again, sometimes people take that personally.
They do.
Oh, you think you're better than my person? Like you think who I had done my stuff isn't good enough for you? Like you need to see blah blah blah. And again, then we need to have a bigger conversation because it has nothing to do with what we're actually talking about. It has to do with the feeling of competition or that you feel personally about my decisions, which is like that's totally cool. I totally get why you went down to Miami. I'm so glad they didn't murder you. But like I'm not willing to take that risk, or my risk, in the beginning when I was going to Mayo probably wasn't the like highest qualified, best plastic surgeon there ever. But at that time for me, I felt like safety was number one and I knew Mayo Clinic wasn't going to kill me. So it was like, all right. So yes, I had a lot of people that were like, you should see this person, that person. And I was like, yeah, no, I think I'm just going to go to where
I'm good. I want to live. And also, I think what I'm hearing is that, like, basically you can use your support people to help you with your other support people. Like, you can use your therapist and bounce ideas off of and do a whole session on that. Or just, like, remember, like, these are your sessions. You get to, like, work on whatever you want to work on. Because my therapist has totally helped me with some communication stuff that I needed to get out. And, knowing how you actually feel before you do anything is really helpful, by the way. So and it's very important during these surgeries, whether it's plastics or bariatrics, that like you have something in place for you, because you just don't know how you're going to react after surgery. Things can come up, things change, and support people can change as well. And I've heard of people, like you said, of like leave midway and now you're kind of stuck. What do I do? And so just think about all the different things that you would need when you do these surgeries.
Sometimes it may not always be. There's someone who recently had as part of their BBL, and their dad made them this special chair. Do you know who I'm talking about? With that zero gravity chair. So he like researched online this like zero gravity chair, and he like cut the hole out, and he put all of this foam. And it was like so funny because I'm like, I don't think I would ask my dad to like make a BBL chair for me. But it's like some people, they're like very
Comfortable.
builder focused dad was like, oh, I could build that. I can make that $300 BBL chair. I could do that. Yeah.
I was gonna say he probably heard his daughter be like, "Ooh, that would be really nice to have for the surgery," and then he's like, "I can build it." It's like, hold my beer, let me go, let me.
I thought that story was going a different direction, but I'm glad the dad was supportive.
Yes.
Right? I know.
Yeah, no, it was funny because he was like very involved in her recovery, which I was like, the last person I really wanted involved in any of my recovery was my dad. No offense to my dad, but like, you know, I'm good.
Well, he must be like a good
We
caretaker, I bet. Like
we had a lady who she was a revision patient, so she'd had, I believe, like a mastopexy and upper back lift. I don't think she'd had her arms done, and so we did. It was a pretty big surgery: forearm reduction, brachioplasty. We did her mastopexy, and we didn't do her back lift. We ended up doing a torsoplasty for her, which is kind of the scar. I think we've talked about that before. So she ended up with a little bit of a complication where she needed some physical therapy, right? She kind of had the delayed like waking up of her arm.
Where you
She
like,
ended up doing fine.
like move it all the way.
Yeah, she ended up doing fine. This was months and months ago, but for her daughter, who was kind of like her caretaker, I think she was divorced if I remember correctly, and her daughter, who was her primary caretaker, or at least the person she had planned to help her take care of her for the first few weeks, just kind of refused to help her. Like didn't really want to drive her around to her appointments, didn't want to help her put on her compression. I mean, she really couldn't use her arm for the first few weeks.
yeah.
Wasn't helping with meals, so, and I don't know what their discussion had been beforehand. And so I think that just really I mean, it made things a lot harder for her in the first month after surgery. And it just was kind of very sad
I
to see.
can't imagine taking on and off compression if I didn't have the use of my arm.
Right?
Yeah. Or like
Again,
meals, right? I
sometimes
mean,
why we talk about like our backup, but particularly if I know like your daughter and you kind of have a contention, like she's really on board right now, but and again, I as a therapist probably have a lot more information than most doctors.
Yes.
Like who's our backup person, who we're going to call and that may be a professional. There are professionals out there who help people post plastic surgery, post bariatric surgery. And so like sometimes that is who we're going to call in, or, I had a client whose like neighbor was like a CNA and would like come chill with her after work. They'd sit and watch TV. She'd get her showered, get her like all back in her stuff. And like every day after work, she'd spliff her some money just to like come check in on her. Cause it was just easier than I think, can't remember who her other support person might've been, a husband or a child. And so she much rather the professional see her naked than her daughter. And so she's like, yeah, she comes over after work. I make dinner. We eat. It's fun. We watch TV. Again, that like social aspect. I think a lot of times too, the professionals you bring in tend to also be part of your social support and who you talk to and your connection with the world, especially if you're just kind of caught in, just week 3, day 2, haven't slept well, annoyed, tired of being compression. The rubbing is bothering, like everything is annoying you. Like sometimes it's nice to have an outside person come in and be like, girl, it's been a day. I got shit on. I got, like whatever. They're CNA. I'm sure they got good stories. And so like your issue is minor.
Yes.
I find, and I don't know, Ashlyn, you might have a different viewpoint, but I find, at least when we ask that initial question of like, who's going to help you after surgery, find the people who have done the least planning are like the older women who might be single, widowed, divorced, whatever it is.
Nothing will stop them.
Sorry?
Nothing is going to stop them.
Yeah.
I have a feeling.
Well, they want the surgery, but they haven't thought about who's, or like, oh, I have a neighbor, they can come check on me. Well, I was like, okay, is you're never going to stay with you for, the first few weeks? Like, who's doing your meals? Are you going to meal prep? Like, they just haven't given it that much thought. And I can understand some of them maybe don't know what to expect after surgery. So they think like, oh, they'll come spend the first night with me or help me for a day or two, and then, they'll be fine. But some of them they'll go back to their place and I'll be fine. And it's like, no, this is not like a 2-day type thing. You need someone, again, they don't have to stay with you for 2 weeks, but you probably won't be able to be completely alone for 2 weeks either.
Right. At very least,
I
you're
find
probably not
those
gonna be
are
able to
the people who,
shower and do all this. Like, they don't need
yeah,
to be in there with you, but like just
correct.
to be
Gotta
around to
help you.
like be like, I am
Yeah.
exhausted and I still have to put
Hmm.
on this faja.
Right. Yeah, exactly. Yeah.
Well, guys, is there anything else about support that we should think of, that we should tell them before we wrap this bad boy up?
We didn't even get into the people who don't want you to have. Did we get into it? When you're doing it for yourself versus others? We did that. Yeah.
Yeah. I think at the end of the day, it is your decision. If you need additional support or the people around you are not giving you the support you need, you may consider talking to a therapist to figure out if this is worth my time to try to work on, or seek out professional, like a CNA or a post-surgery nurse. But I do think that this can be an opportunity to build on some of those relationships, to show vulnerability, to say, I know you think of me as a really strong woman who would like never want this, and it probably looks super vain to you, but like, let me have an actual deep conversation with you about what's going on for me. Because that may actually be an opportunity, especially if you're someone who doesn't usually ask for support, to actually build in that relationship. And that may be a parent, that may be, a parent that always saw you as really independent and maybe feels like they didn't do you right in your childhood to some degree. And this is a experience for them to have a corrective experience, to be able to actually take care of you. And there's some vulnerability in you allowing that to happen. And maybe that actually builds the relationship. But it also can go, as we talk, the other way, where jealousy, insecurity, that maybe those conversations are not had, or they are had, but they aren't honest. And it can, cause a rift. And so maybe that's an opportunity to allow other people in your life to step up or be part of your support. And that's probably something you need to think of kind of before you're sitting there at 2:00 in the morning and your husband has stormed out and your faja is half up and you can't use your arms.
Yeah.
I think one of the other, and I completely agree with that. I think, you've got to surround yourself with people who are gonna help you. You have to kind of leave the negative out or keep the negative out. I think, as you said, Ashlyn, you have to decide maybe which battles are worth fighting, and maybe who's worth fighting for, or who's worth sitting down and having that discussion with. I do think, and this is something I also tell a lot of my patients when I hear the types of things like, well, this person's against it, I think everyone has different priorities, right? One of the examples I give is like people buy season tickets to their favorite football team, basketball team, whatever, sports team. That's, plastic surgery is expensive, but that stuff's not expensive, or that stuff's not cheap either, right?
No, it's
People like boats, people like cars, people like watches. So, I think if this is something you feel is important to you and is worth spending the money on, then you do you. People don't generally criticize you if you go out and buy a new car because you earned it, right? So I feel like if someone's worked hard enough for this and has saved up money and can financially do it, then that should be their choice. So
I couldn't agree more, because that's like the hardest part, is that you hear that where it's like, are you vain? No one's really thinking about like how this is going to better your life. And I know when I go through this process, like I really want to have like people around me that, one, I kind of want someone that's already been through it. I think that's important. That's important to me, because then they know exactly what I'm going to need. And then I'll be talking to my therapist about it when I finally like make that decision. So it's just knowing where to get your support at and knowing how to use your support, because you do have to ask for the help. Like, they can be there all you want, but they're not reading your minds. They're not, like inside your head and getting like what you're feeling. So you have to express that. And I know it can be very hard, very vulnerable, very scary, but you can do it. And you're worth it. Like, if you're going to pay thousands of dollars to have your body change to what you want it to be, like, then do the whole thing, talk the way that you need to talk to people, get the support that you need to get, take the vitamins, do the things. So, I want to just say thank you for you two for like getting really, really deep of what support looks like. 'Cause it's a lot of stuff. It's not just, oh, you need a friend. You need someone there. There's so much to it. So
Your random neighbor who's never seen you fully, like maybe not in a bathing suit, like they may not be who you choose.
Yeah, 100%. It's
I
so
imagine someone being like, I'm going to use my neighbor, and I'd be like, No.
Absolutely not.
How
Absolutely
close
not.
are you and your neighbor? You and your neighbor real close? Like,
Right?
real
I will say we've had patients who like we get a lot of out of town patients, and there's like a group online. I don't know if it's like specific to me or specific to Orlando, but we've had patients who've helped, like local patients who've helped out of town patients. Like, oh, I
Right.
lent them this. I'm getting this from,
Yeah.
so and so.
Oh
Can't say
yeah,
names, but they'll give me names.
Yep, I have
Um,
rotated all of my stuff because honestly, I don't need it. So like
it's
a friend
great.
of
I
mine
mean, it's
had
great to
it,
see
and
that.
so I was like, perfect. You can have all of my pillows except the one I
Yeah.
like the one triangle pillow. I think that's
Ooh.
So
also
it's great
pretty
to see.
big in gender affirming care. Is I've
Hmm.
had a lot of where they've had to go out of town just because there isn't a lot of support there.
Yeah.
And so it is often the other patients of that surgeon who are actually the ones stepping up to say, you can stay at my house.
Yeah.
I will I'll help care for you. And I think that particularly post bariatrics, we're in a similar boat where there's a lot of people that, even though we may not actually know each other, like probably would open up their homes or, at least
Hmm.
like, hey, I have leftover this, that, and the other. Do you want to use it? Or I'm
Right.
sure that crazy BBL chair that lady's dad built her, like that could be
Maybe
stolen.
that's a business idea now.
No, it was such a good idea. I'm
I'm
like,
gonna
I
say
wish
that
I
should
had
go on
thought of
short
that.
or
It was a
they need
zero gravity chair with a hole in it. And I was like, even a zero
But
gravity
the
chair for sleeping would have been a great idea in my living room.
Yeah.
But the point I was going to make is, check Facebook, it doesn't have to just be your surgeon, check the community, the city where you're having surgery, whether it's in your city or elsewhere, and there might be some resources there. And you'll definitely find support, right? I mean, you'll find some negative people too, but you'll find some support there.
Well, thank you guys. And until next time, make sure that you're always following, sharing, commenting. We'll have all the links below for your resources. And yeah, be kind to one another, guys.
Great message.
Yay, that was a good one.